My name's Bryony and I am from MQ Mental Health Research, and I'm here this lunchtime to give you a very brief introduction to just some of the research that is going on into the impact that COVID is having on our mental health. And I'm absolutely delighted to be joined today by Professor John Geddes, who is head of the psychiatry department at Oxford University, a Turing Fellow at the Alan Turing Institute, and the director of the National Institute for Health Research. John, welcome. Thanks for joining us.
Thanks very much indeed, Bryony. Thanks for a nice introduction, and really delighted to be joining you this afternoon to talk some about the research into COVID and the long-term effects of the illness on people.
Thank you. So just a few caveats before we really begin. Whilst John is a psychiatrist, I am not. So we won't be giving any personal advice today about treatment or talking about any individual circumstances. We're just here to tell you a little bit about the work that is being done in this area and how you can get involved as well. But first of all, who are we? Well, MQ Mental Health Research is the only charity that exclusively invests in scientific research into mental health. So we work across all mental health conditions, but when we look at COVID specifically, we're aiming to improve our understanding of how COVID itself and the pandemic more widely is affecting mental health. We want to improve the treatment of mental illness, both by developing new treatments and finding the best routes to treatment. But ultimately, we want to find ways of preventing mental illness in the first place. So for COVID, that's identifying the groups who are most at risk of developing mental health issues and then finding interventions and preventions. Now, it's important to know the facts about COVID and how it is affecting people so that policymakers can make informed decisions. So for that reason, a lot of research has been undertaken to monitor the impact of lockdowns, of social restrictions, and of the virus itself on mental health. 1 in 9 people have experienced poor or deteriorating mental health since the start of the pandemic, but that isn't the whole picture, as there are actually some groups whose mental health has improved over the last 18 months. Now, people with a mental illness do, on average, die 20 years earlier than the general population. And this has also been reflected in the COVID mortality figures. So just last week, this report was published in The Lancet, which found that people with an existing mental health condition or a neurological disorder were more likely to die from COVID-19. So understanding the mechanisms behind this comorbidity is going to be really important if we're to find ways of preventing people from being gone too soon. 25% of people hospitalised with COVID experienced significant symptoms of mental illness just 5 months later, including depression and PTSD. And John will be talking more about the phosph study, which uncovered this in just a moment. So MQ has worked with the Mental Health Foundation and with Swansea University to determine the impact of the pandemic on children and young people. And together, we've surveyed thousands of young people across England and Wales on a regular basis since the pandemic began. And the most recent results this summer found that 14% of teenagers reported that their mental health was poor. Although it should be said that that was an improvement on the figures from this March, where that figure was 18%. Now, loneliness was a big problem for 13 to 19-year-olds, with 64% saying that they sometimes or often had no one to talk to. And another group where we actually don't have enough data is on people from ethnic minorities. So Black and other ethnic minorities were more likely to die from COVID than white and Caucasian people. And they were more likely to have their mental health impacted as well. However, the level of reported stress caused by COVID is the same for all ethnicities. So determining why this group is more impacted will require further research. So I'd now like to bring in Professor John Geddes from the phosph study. So John, thank you so much for joining us today. John, can you tell us a little bit about the phosph study and what it was you were looking into?
Yeah, absolutely. Delighted to do that, Brandon. Thanks again for inviting me along today. I mean, when the pandemic first started, obviously there were a number of studies that collectively the research community and working with patients and government funders, policymakers thought we should get going. And obviously there was the vaccine program, there was the large-scale trials looking at the effects of treatment, when the incredibly successful recovery trial that found that dexamethasone reduced mortality. But we also anticipated that really early on, because of the nature of coronaviruses, then there would be quite the potential for long-term problems in people who'd suffered from the illness. So primarily the virus affects the lungs initially, but we already knew from reports from Wuhan and from Italy that it was really quite a severe virus that affected a lot of organs. So led by Professor Chris Breitling and Rachel Evans at Leicester University, we put together a large prospective study looking at patients who had the virus and had been sufficiently ill to be admitted to hospital. And then the phosph study put in place a long-term follow-up of those patients after discharge to see what happened to them. And by getting sufficient numbers of people who'd had the effect of the virus and had to be admitted to hospital, to also measure what problems they had over the longer term. But then, importantly, I think, to see if there was anything that we could do early on in the course of the illness that might reduce the problems that they suffered in the longer term. So that was it was put together incredibly quickly. I mean, I think we started talking about the study around June 2020, and it's been underway now for well over a year. But a really critical thing that I think Chris and Rachel thought right at the beginning with the NIHR and the UKRI who were funding it was that we had to ensure that the study looked at the whole human. So as well as looking at the effect on long-term breathing or heart or kidneys, we also looked at the effect that it might have on the brain and on mental health. So we were invited to collaborate really early on and to make sure that we were assessing long-term outcomes on mental health symptoms, neurological symptoms, and the way that they interact with the other parts of patients' functioning. And that's really unusual because quite often medicine tends to look at one organ or another. So phosph is an incredibly unusual study because it's actually looking at the whole body, including the mind, and every other organ. So for example, and we're hoping to recruit, I think we already have recruited around 5,000 patients to the quite intensive follow-up part of the study. So really pretty big numbers and very intensive follow-up, including follow-up of symptoms. So for example, a significant proportion, I think it's around 400 of the patients, will get full body MRI scanning, including brain and neuroimaging. We'll be monitoring their mental health on a week-by-week basis, and we are assessing their cognitive functioning, so how well they can think, remember, because of course there's this concern that the infection can affect people's brains and in some cases lead to cognitive impairment or even dementia. Really important that we identify who's likely to get that quite early on, look at the mechanisms and then see if we can develop treatments. So the kind of reason for doing this study is both description so that we know what we're dealing with, but really importantly to be able to mobilize treatments very early on and to be able to target them to treatments that we're beginning to learn have the problem. And that's what we've been doing, and actually it's been hugely successful. It's across the whole of the UK, fantastic kind of collaboration. I lead the brain working group, but the working groups kind of cut across each other. As you know, we've got good charity representation and user representation from charities like MQ who are there at the meeting, so that we can make sure that we're prioritizing our research on the kind of things that patients and the charities tell us are important to them, as well as to clinicians and scientists. So that's the sort of the description of the study where we are. I have to say, Bryony, that at the moment we've done the first analysis, and I think you've got a slide looking at some of the symptoms, the results of that. We are really just at the beginning of beginning to exploit the richness of the data in this study. And we're also now beginning to work out what will be the treatments that we target, that we test really early on, as we pivot the study to more of an interventional study over the next few months. And obviously some of the things we're interested in there is knowing more about the effects of the virus on the brain, how it leads to the specific problems that we've seen people experience following the infection, and then to sort of test some of the interventions that might be effective in reducing the risk of people developing that, or might improve the symptoms once they've already got them.
Wow. And I know we've got another slide here as well, looking at long COVID symptoms as well.
Well, so before we put in place the phosph COVID study, because the advantage of that study is that it was set up prospectively. So in other words, we put all the data capture, we put all in the sort of we set the eligibility criteria, we do all the description of patients as they recover from their acute infection in hospital, and then we follow them up over time. But of course, doctors and patients needed to know really early on about what was the likely effect of the infection, because the health service has to respond. And one of the things we saw during the pandemic was the way that, you know, we went from that really not knowing what we were facing to being actually quite good at being able to pick up the kind of problems that patients would have and be able to target treatment at them. One thing we had absolutely no idea about, although we thought it was going to be important, and I know MQ and the Academy of Medical Sciences identified this early on in their position paper they published in Lancet Psychiatry, was that we anticipated that patients who had the infection would be quite likely to get long-term neurological and mental health effects. And although we could wait for phosph to give us the data on that, we needed data more quickly. So we did a study looking at routine patient records from the States. The advantage of that, of course, is that that is real time. So that the data are coming into that database right from, you know, continuously, even before the pandemic. And the population it covers is enormous. So we got over 80 million patient records, which gives us the kind of statistical power that we need to begin to pick up problems. And within that 80 million, we could find that, you know, well over 250,000 people who'd had COVID even really early on. And even those kind of numbers are big enough to be able to allow us to quantify the effects of the problem. So we've reported, I don't know, 4 or 5 papers from analyses of that. And you can see that we've been able to both look at the sort of the mental health and neurological symptoms, but also more recently we've reported on what people are calling long COVID. So what are the symptoms that people get across all the parts of the body in the longer term? And you can see, and this is consistent with the results that are initially coming out of phosph COVID, and unfortunately, quite a high proportion of patients continue to get problems in the longer term once they've had the infection. So phosph COVID, the initial results from that study have found that after 6 months, only about 1/3 of patients fully recovered. Those are patients who've been admitted to hospital. And other studies suggested that that proportion is higher, so more people have recovered if they've been less severely acutely affected during the phase of the illness. But I think it demonstrates that this is a really unpleasant infection. But of all those people, because the American study looking at the Trinetics database on the 80 million patients was not restricted to inpatients. We included everyone who'd been in contact with a health professional. And you can see that amongst that group, 1/3 of patients were diagnosed with at least one long COVID symptom. That includes everything from fatigue to breathlessness through to depression, anxiety, or cognitive impairment. And that the likelihood of people getting long COVID symptoms would be affected by the severity of illness that they experience from. So that's consistent with the results we're getting out of phosph COVID, and you might anticipate that. But also that obviously people are more likely to get those if they're older. Females, I think, were more likely. And so we're beginning to work out who is more likely to get those symptoms. That means we can put the support and the treatment services into place earlier on that can target those people who particularly like to get problems. We've often known, and we've known for a long time, that infections like flu can lead to symptoms or chronic fatigue syndrome or ME. And there was a query about whether COVID was more or less likely to do that than other acute respiratory infections. It looks as if it's much more likely, unfortunately, than those infections is to lead to these sort of longer term problems. It's probably about twice as likely to lead to these problems. So it isn't just the same of any other viral illness. It looks like it's a particularly horrible illness to get. The worse you get it, the worse the longer term outcomes. But there's going to be quite a big burden of disability due to COVID. We're currently looking in the phosph COVID study about what happens at a year, and then we'll continue to follow them up. And we're just looking at the year data at the moment. Unfortunately, it still looks that even after a year, those people who haven't recovered by 6 months, there's a really high proportion haven't recovered by a year too. So we are going to have to find new treatments that can help those people recover, because there's a lot of morbidity associated with this illness. And it's one of the reasons that we were right eventually in this country and others to take it so seriously and to try and limit the effects on the population, because it isn't the case that you just get it and then you bounce back. You're lucky if that happens, but a lot of patients, particularly those people who are badly affected by it, really struggle to recover.
Gosh, it's such important work that you're doing at the moment. So thank you so much for sharing that with us. I know another study that's been funded by the NIHR is the COVID CNS study. Now MQ is supporting this study through the PPIE strategy, or the patient and public involvement and engagement strategy. And we actually have a video to play about this one.
So we're increasingly recognising that COVID-19 is not a condition simply of the lung. In fact, it's those patients that are most severely affected who are the ones who've got brain complications from the virus.
So it can cause a wide variety of symptoms, from sort of pure neurological symptoms such as walking, moving problems and sensory problems, through to memory and other cognitive problems, and also frank psychiatric symptoms such as mood disorders, psychosis, and this can be due to a wide variety of mechanisms.
Critically, clinicians and scientists do not understand what's driving these brain complications. To what extent is it viral infection within the brain, or an excessive immune response attacking the brain, or some other form of brain injury? And without understanding this, we simply do not know how best to treat these patients.
The COVID Clinical Neurosciences Study, or COVID CNS, is a study that aims to understand the effect of COVID-19 infection on the brain, why some people develop neurological and neuropsychiatric complications and some do not. It's a collaboration across all 4 UK nations. Clinical neurologists and psychiatrists are working with scientists in the field of genetics, neuroimaging and immunology in COVID CNS. We want to recruit people who've had a neurological or neuropsychiatric complication while in hospital with COVID-19. We want to compare them to people who've been admitted to hospital with COVID-19 who did not experience these complications. It's
a UK-wide study that's going to be recruiting many hundreds of patients with neurological and psychiatric complications of the virus. We're then going to get full clinical details about how the disorder manifested itself and try and get further details about more subtle complications that might be present.
Firstly, we'll look back at their clinical records and their brain imaging at the time they were unwell, obtain any retained blood or spinal fluid samples that might already be in the laboratory, to understand the inflammatory response and the immune response at the time they became acutely unwell. Hi, morning. Come on in. Secondly, once they've been discharged from hospital, we'll invite them to a face-to-face appointment to assess their cognitive function and their neurological symptoms and signs, how they're doing from a psychiatric and mental health point of view. At that time, a proportion of patients will have a blood sample, so we can look at their genetics and their brain injury markers, and also a brain scan, so we can correlate what's happening peripherally with what's happening in the brain. And finally, we'll invite these patients to be followed up online on 3 occasions over the subsequent year to assess what are the longer term impacts of this.
We're really hoping that the study is going to be able to reduce these neurological complications of COVID-19 for these patients.
So, if you're a patient who's been hospitalised with COVID-19 and suffered brain complications at that time, or you're a clinician or scientist, or you'd just like to find out more, either email us or visit our website.
So as I said, the way that MQ is supporting the CNS study is through the PPIE strategy. So involving patients and engaging them in research is one of the key things that MQ works to do. Now, so far, the studies that we've talked about have been specifically about how the COVID virus impacts mental health. But what about the stress of the pandemic itself? And in particular, how has it affected the most vulnerable group of all, children? Well, as you can imagine, things have largely gotten worse for the COVID generation. Now, mental health issues among children were already on the rise even before the pandemic struck. In 2017, 1 in 10 children suffered from a diagnosable mental disorder. In 2020, that figure was 1 in 6. That's more than 3 children in every classroom. In 2017, 338,000 children had been referred to children's mental health services. However, over the last year, referrals to CAMS have increased by 35%. And in fact, just 3 weeks ago, figures were published by the Royal College of Psychiatrists that show nearly 200,000 young people were referred to mental health services between June and August this year, so in just 3 months. Now, the survey I mentioned earlier that was co-produced by MQ and the Mental Health Foundation and Swansea University this summer found that 57% of teenagers now feel pessimistic about the future. Now, of all the research, I'm skipping forward, of all the research that's been done into the impact of COVID, it has been found that young people are one of the most vulnerable groups, alongside women and ethnic minorities and people of lower economic status as well, who are all more likely to experience negative mental health outcomes than the general population during the pandemic. So Professor Matthew Hoptoff from King's College London told the House of Lords last September that when it came to children, as the group who were at the least risk of mortality, they were paying the greatest price when it came to their mental health. So what are we doing about this? Well, one of the areas that MQ has been leading the way on over the last year is taking all of these research findings and sharing them with policymakers. So in April, MQ led an all-party parliamentary group for a fit and healthy childhood to publish a report on the state of young people's mental health and to make recommendations for policymakers. And this report was produced by 41 experts and academics in child development and mental health. And it made a number of evidence-backed recommendations to the UK government for ways that they can protect children and young people. This included better support for vulnerable children in schools as well, having different groups work together to improve support and services across the UK, allowing researchers access to routinely collected healthcare data so that they can get more up-to-date information, and of course, more funding for research. Now, following this report in April, in May, the then Education Secretary, Gavin Williamson, announced a £17 million boost in funding for schools and students to help them recover from the impact of the pandemic, including £9.5 million to train a senior mental health lead from staff in 7,800 schools, an additional £7 million to train other staff that are working with children, A Department of Education funded link programme to get educators and healthcare leaders working together, and a new staff charter to protect teachers and their colleagues. So by using our network of experts and evidence-backed recommendations, MQ has successfully influenced government policy in a positive way to help protect children and young people. And this is the kind of change that we want to see more of. So researchers, scientists, teachers and policymakers all working together to see real change that improves people's lives. Now, among children and young people, the stress and uncertainty that the pandemic has brought has added to the already rising levels of depression and anxiety in under 24s. So MQ has supported a study by Dr. Catherine Young from King's College London, who was aiming to understand the full impact of the pandemic and then take learnings from that to try and improve support for people suffering from anxiety and depression in the future when it came to other life stressors. So things like health problems or economic problems in the future. So her study will improve the way we support children like that in the future, but also it's going to create a large data set on youth stress and mental health that will be available for other researchers. Now, post-traumatic stress disorder, or PTSD, was already a huge area of study for MQ even before the pandemic. So we were supporting a study by Dr. Jennifer Wild from Oxford University, who was trialling a new intervention for healthcare workers. So since the start of the pandemic, as you can imagine, it's been a real issue for the doctors and nurses working in the NHS with what they've had to face. PTSD has been a real concern. So Dr. Jennifer Wild's work is ongoing, but she has had some fantastic results so far and is really confident that this new treatment she's trialling is going to be considered a success. So as John mentioned, we have been working with the Academy of Medical Sciences, and we've convened a multidisciplinary group of experts to lay out what the research priorities are as we move out of the pandemic. So I'm going to whiz through these very quickly. So we want to take a holistic approach to research. So looking at physical, social, mental and environmental factors, because we understand that we're not going to be able to solve the biggest problems in mental health if we're working in silos. We want to focus on vulnerable populations so that we can really help the people that have been impacted the most. It's very obvious that researchers needed rapid access to health data in a very fast moving situation like the pandemic, and also the quality of that data has to be high and it has to include a diverse group of people. We are very keen to continue involving people with lived experience, which is a natural priority for MQ to include, considering that weighs very heavily on what we already do. We wanted to strengthen interdisciplinary collaboration, so having all of those different experts with different skill sets working together to collaborate and strengthen the quality of research. And we wanted to embed the COVID-19 response within the broader context of mental health so that it can help us understand other factors such as social determinants. And finally, much attention has been focused on describing the extent of mental health problems during the pandemic, and now it is the time to start focusing on solutions. So John, we've got a couple of minutes left, so I'd like to bring you back now to maybe talk about some of what you'd like to see in the future when it comes to research.
Well, thanks, Bryony. I think you're absolutely right. I mean, it's always been acknowledged that it's all very well describing what happens, but really the smart move is to move as quickly as possible to interventional kind of approaches. And so we've got a range of studies underway at the moment that will be looking for targets to develop new treatments for both in people who've suffered from COVID, but also, as you're just talking about, the effects on the population. So, for example, researchers in my department, Kathy Cresswell and others, are targeting interventions at the needs for younger people who've been particularly affected by the effects of the lockdown, psychological-based interventions that can help them adjust to the complete change in their lives over the past few months that have led a lot of them to suffer from anxiety and depression. So that's the main change that's really happening, is that our attention now is much more aimed at specific interventions and evaluating those as quickly as we can.
Yeah. So we have come to the end of our time today. So John, I'd like to thank you again for joining us. It's been absolutely fantastic hearing about the work you've been doing, and keep it up as well. We need you.
Thank you very much, Bronnie.
I'd like to thank everyone for joining us today as well. If you would like to find out more about the work of MQ, then please do take a look at our website. It's mqmentalhealth.org. And if you would like to chip in and support some of our work, then please feel free. There are lots of ways you can get involved. You can donate through our website. And if that you work for runs any kind of charity partnership scheme, then please nominate MQ. We would love to start working with more corporate partners. And if there's anyone on the call today from Deutsche Bank, then please consider voting for MQ to be Deutsche Bank's next charity partner. So with that, I will leave everybody. Thank you very much for joining us today, and thank you for your time, John.
Thank you.